Good morning. My name is Brian Coe. I'm a registered nurse in the state of Colorado, working on the completion of my bachelor's degree from Pueblo Community College. I've been a nurse for 14 years, climbing the ranks, as I started from a secretary and telemetry technician over 20 years ago. I'm board certified in emergency medicine with aspirations to become a family nurse practitioner, and I have a deep passion for helping disadvantaged populations. This paper and the accompanying PowerPoint presentation addresses the components of human trafficking. It is extensive, so feel free to sit back, relax, and enjoy a cup of coffee. This presentation will start with a pre-assessment quiz and self-examination. Then we will look at the summary of human trafficking basic information, the correlation between human trafficking and community health, while achieving some of the goals from Healthy People 2030, a directive from the U.S. Department of Health and Human Services. Additionally, this presentation will address statistical data and epidemiology for traffic victims, identifying and recognizing these persons, addressing bias or barriers which could hinder student learning, and the relevant nursing theory and nursing care plans associated with these patients. Finally, there will be a post-instructional quiz to address the student's understanding of the enclosed material and a final assessment of this instructor's teaching to evaluate areas for improvement. Starting with the pre-quiz, I'll give you some time in between these questions. What demographics, when presenting with signs of abuse, are mandatory to be reported? What might be a reason that a victim chooses to stay with her trafficker? And finally, what does the typical trafficked person look like? In a self-examination, I ask that you don't answer out loud, but do you personally know anyone that has been trafficked? Have you heard of any reports of trafficking, either through friends, family, or the news? And take a moment to visualize what the situation of a trafficked person might look like in your mind. And then we'll proceed and examine if the research into this topic matches your assumptions. Human trafficking, as defined by the Department of Homeland Security, involves the use of force, fraud, or coercion to obtain some type of labor or commercial sex act. Although sexual trafficking does get most of the attention, labor trafficking is another large component of the trafficking paradigm. It is the recruitment, harboring, transportation, provisioning, or obtaining a person for labor or services for the purpose of subjecting that person to involuntary servitude or bondage. In essence, trafficking is modern-day slavery. Human trafficking is a criminal industry based on modern economics of supply and demand. Human trafficking does not exist simply because people are vulnerable to exploitation, but it exists because there is a demand for cheap labor or commercial sex. The criminal traffickers are bolstered by the duality of low risk and high profits. Historically, prosecutions for human trafficking have been low due to a lack of insight into the problem and the convoluted nature of identification of these victims. Without the need for governmental oversight into labor, criminal enterprises don't incur the costs associated with fair labor practices and thus profit immensely off the slavery of vulnerable people. According to the Office of Disease Prevention and Health Promotion, there are several objectives which coincide with human trafficking in an effort to address the secondary prevention and screening for vulnerable populations. Specifically in the Healthy People 2030 Directive program, they identify several categories which address this issue, and that includes violence prevention and increasing social and community support. In the violence prevention category, their goals are to reduce non-fatal physical assault injuries, reduce work-related assaults, reduce sexual violence, reduce adolescent sexual violence, In the social and community context, the goals surrounding increasing the proportion of adolescents who have an adult that they can talk to about serious problems, increasing the proportion of children and adolescents who communicate positively with their parents, and increasing the proportion of children and adolescents who show resilience to challenge and stress. In a journal paper submitted to the Governance of Social Development Resource Center, the author offers some impacts which affect all aspects of life for the community and the nation. In terms of economics, trafficking creates a loss of human resource and productivity. Furthermore, the author cites a U.S. Department bulletin which reported that up to $325 billion as an expected loss of remittance to developing countries. The same bulletin states there is a significant but unmeasurable loss to the productivity and capacity of a generation of individuals as a result of these trafficked victims who might have otherwise increased their education and improved their health. Ms. McCormick goes further to say that the societal impact should also be considered. For example, trafficking directly impacts the family and community left behind. Again, this devastating impact is impossible to be quantified. Citing other journal articles, the left behind suffer a breakdown of family ties related to the neglect of children and of aged persons. Trafficked victims often sustain psychological and physical trauma, making them more likely to become involved in substance abuse and criminal activity. The health impacts are thus undeniable. Trafficked workers often live and work in overcrowded conditions which would be considered unsanitary and unsafe. Frequently, these human packing farms are sites of communicable disease outbreaks, placing the greater community at risk. Addressing issues on the national stratum, profits from human trafficking undermine national security, as it does fuel criminal enterprises, which are activities that are estimated to be worth more than $9.5 billion annually. There are several organizations and national entities which focus on this population. Some of the more prominent names include the U.S. Department of Homeland Security, U.S. Department of Health and Human Services, U.S. Department of Justice, the National Human Trafficking Hotline, the Polaris Project, ECPAT USA, Human Trafficking Institute, and the Coalition to Abolish Slavery and Trafficking are just to name a few. The government's interest in this social cause shows just how pervasive trafficking is to the welfare of the community and the nation as a whole. Next, we'll examine a survivor story, a real story published on YouTube. You're welcome to watch this independently on your own here. We'll go ahead and watch it now together.
I was born in Milwaukee, and when I was about 8, my mom moved my sister and I to the suburbs around the Hartford area. When I look at this picture of myself, I see a happy little girl that had all of the normal things that children had, normal birthday parties with lots of friends and people all around and everything happy and cheery. I think, to the outside world, we looked like a normal American family.
I always felt that living in the suburbs was, if you lived in the suburbs, you lived a Lifetime movie, perfect life type of thing. Little did I know that I actually threw my daughter right into the fire.
I met a guy my junior year of high school, and I thought he was it. I thought he was super cool and was going to be my knight in shining armor. And little did I know he was into drugs. He was into the drug scene. But I persisted anyways, and I stayed in it, and sure enough, it wasn't long before I started doing those very drugs with him.
My sister started dating this boy, and she was crazy about him, and for the first time, she started to lie, and it were just very small things about, where she was and who she was with, and it was like, well, that's not typical of her. Why would she be doing that? And so that kind of really stood out to us, and it was just very simple things.
I had met my trafficker, my drug dealer, through another female. She wanted to be my friend. She wanted to help me, and at the time I really needed somebody. I needed a shoulder to lean on, and she was that. Little did I know she had been watching me for months.
They were getting to know her. They were, finding out information about her family, her friends, what she liked to do, what her insecurities were. They were her people for 2 years.
And my drug dealer kept saying, "Come stay with me. I'm gonna make your life better." He sold me the American dream, and I bought it. I was in need of somebody saving me. I thought I needed saving. So by the time I got to his house, had him pick me up, he took my identification and social security card. He had everything. He promised me, just little things like going shopping to get a new wardrobe, or, a car, or my tickets paid off. Things girls around my age needed.
They saw her vulnerabilities, and they also gathered information to use against her.
I didn't have a lot of personal items, but I always had pictures of my nephews. So when somebody holds a loaded gun to your head and you say, "You do what I'm telling you to do, or I'm going to kill your loved ones," you do it. So that's how it happened. He had the phone, so he would take the calls. A lot of this was done through text message. A lot was done through apps, through various sites, and through a touch of a button on his phone, he sold me to the highest bidder. More often than not, it was men on their way to work with their families at home, or men on Sundays, and they drop their wife and kids off at church. It is men you would never think about. Your CEOs, your businessmen, your soccer dads, cops, politicians, priests, you name it, I've probably come across it, and if I haven't, I know somebody that has.
When Em disappeared, it was actually on my birthday. She had called me to wish me a happy birthday. And then she told me that she had gotten a job to be a nanny in St. Louis, and she was going down there. And the whole thing just didn't set right with me. So I told her how I felt, and then we hung up. And then a few minutes later, a gentleman called and kind of read me the riot act and told me I was never going to see my daughter again. And then I lost it, and I just felt like the life was sucked right out of me. I felt so helpless.
So I spent about 7 hours at the police department, and I sat down with a few detectives there who enlightened me to this whole other world that I was completely naive about. There's this website called backpages.com where the police officer told me you can order a woman faster than you can order a pizza. I kind of gave him a description, and it took a few hours, of them searching and me searching, and we found an ad for my sister for sale. They had dyed her hair red, and there was a number on there. And so from there, we Google searched that number and found that she was listed on about 20 other websites for sale.
I had never even heard of Backpages, and here these women are being posted for sale, and there's the phone number, and that's the same number that's on my telephone from the caller ID, and I just oh my God, who does this?
But I put up I think it was maybe the same night, I put on Facebook, my sister is missing, I need your help. I have some really, really amazing friends who tweeted it out.
After a certain point, I had realized that they were looking for me because there were missing persons posters up and a Facebook page, but I was hiding in plain sight. And so many victims today we are hiding in plain sight. There were multiple times that I knew I wanted to get out of the life, that I needed to get out of the life, but I didn't know how, and I didn't want to be dope sick, and I didn't want to go to jail. I was scared. I had went into a store and stole a bunch of hygiene products, and it was almost like I did it intentionally to get caught. The female officer came, and I turned around and put my hands behind my back and said, "I'm ready. You can take me." And she's like, "What are you doing?" And I said, "I'm making your job easier." Because I knew I was getting arrested. And I got into the cop car, and there was a song playing with the words, "I know you'll be safe and sound." I took a deep breath, and I knew, as much as I didn't know I was a victim, I knew from that point forward everything was going to be okay. There is not a single county in our entire state or our nation that has not been affected by sex trafficking. Sex trafficking does not discriminate. It does not look for where you have come from, how you grew up. There are no boundaries. I am proud to be able to say that I have trained over 2,500 professionals in our community throughout our state.
These are people who are going into homes that need to know what to look for. You know, multiple people living in a situation, not enough beds, too many people, women who are bruised.
I want people to be able to talk about it openly. I want people to not be judged who have been through it. And I want parents to know that it can and will affect your family if you do not become educated. And if I can change one person's life, one person's perspective, that means I did my job. My name is Emmy, and I am a sex trafficking survivor. And I am the founder of Lacey's Hope Project.
All right, so as you can see, that's a pretty touching story, and it's important that all of you students listening to this now realize that you can make the difference in somebody's life. Looking at the epidemiology, according to the U.S. Department of State, reliable statistics on the extent of the trafficking problem is difficult to ascertain. This particular crime involving labor and sexual trafficking are grossly underreported due to various factors such as the underground nature of the crimes, challenges in victim identification, gaps in data, and barriers to information sharing. Citing a bulletin from the International Labor Organization dated 2017, in any given moment there were 40 million people imprisoned in modern-day slavery across the globe. This did, however, include instances of forced marriage. In its trafficking of this data here in the United States, the National Human Trafficking Hotline received nearly 50,000 contacts on trafficking concerns, with a reported 11,500 victims in just 1 year. Of that number, 10,490 were victims or survivors themselves. 3 states ranked the highest in this category: California, Texas, and Florida, which accounted for nearly 1/3 of total cases. Sex trafficking accounted for the largest portion of victims at 8,248, followed by labor trafficking at 1,236. The remaining cases had a combination of either both labor and sex trafficking, or they were not specified. The largest component of labor trafficking involved domestic work, followed by agricultural. The top industries for sexual trafficking were illicit massage and spa businesses, followed by pornography. Females composed the largest group at 87%, while males were the remaining 13%. Adults comprised of 62%, and children were at 38%. Naturally, any number of victims is too many. As stated before, though, this count is still far below real-world numbers. In a data report from the National Institute of Justice, from 2020, which conducted 3 study sites to ascertain the level of underreporting. They concluded that the tallied totals represent only 14%, at most 18% of the potential trafficking victims. 2 of those study cities had underreporting as low as 6%. Incredibly, this means that there could be as much as 175,000 victims, but even conservative numbers could place this number over 50,000. This wide diversion of estimates is reflective of the difficulty in reporting and documenting these victims. And so, who are these victims? Summarizing the victims into a particular demographic group is a futile attempt. There is no way to profile potential victims. Victims have been identified in cities, suburbs, and rural areas in all 50 states. These victims come from diverse socioeconomic backgrounds, varied levels of education. They include citizens and immigrants alike. There are some interesting correlations, though, in which those people trafficked are preyed upon due to their vulnerabilities to family and community dynamics. For example, runaway and homeless youth are especially vulnerable to traffics in which the perpetrators pretend to be a boyfriend or significant other and used feigned affection and manipulation to elicit or extort their victims. Foreign nationals, in a similar setup of vulnerability, have little support systems and lack familiarity with the laws of the United States, the rights of its citizens, or even language fluency. Although this presentation addresses the audience of healthcare workers, being able to identify a possibly trafficked victim requires further education and training for all public service providers. In a published research paper in the Journal of Crime and Justice, it concluded that law enforcement officers were generally uninformed about human trafficking, and they had limited experience with human trafficking cases. Protocol and policies covering this topic were lacking in addressing the topic in a survey. The author cited that despite 72% of agencies believing that trafficking should be addressed in some way, yet only 8% had any training on the matter. Donna Sabella, a PhD and registered nurse who authored an article in the American Journal of Nursing titled "The Role of the Nurse in Combating Human Trafficking," she reported from a study which found that 28% of trafficking victims had come in contact with a healthcare provider during the captivity, and the provider didn't even realize the patient was being trafficked. She says this study wasn't exclusive to the emergency department either. Some of those victims in the study had presented to dentist's office or physician's offices. A case study published in the Journal of Midwifery and Women's Health followed the story of SM, a 26-year-old female. She came to the United States 2 years ago from Mexico. She speaks a dialect of Spanish called Mixteco. She speaks some Spanish and no English. She left behind 2 young children in her attempt to enter the United States illegally through the use of a smuggler. She was indebted to a criminal organization for $8,000. She was separated her boyfriend during the journey and was subsequently robbed and gang raped. Upon her arrival to the United States, she walked for days in the Arizona desert with little food or water. She was transported to the state of New Jersey, and she was employed as a nanny for a family and finds herself pregnant. The family treats her well, despite a wage of only $6 per hour, which is slightly under the federally mandated minimum wage of $7.27. The smuggler has been making harassing phone calls to the house about money he is still owed. SM is worried about losing her employment if he continues calling, and despite her wages, she has been able to pay him back due to the high interest rate he charges her for the loan. The smuggler threatens the family, threatens the life of her now 1.5-year-old baby, and the life of her mother and her children back in Mexico. In an agreement to pay off her debt faster, she agrees to have sex with the smuggler and his friends. SM feels hopeless, with no end in sight. SM is being seen in the clinic today for abdominal pain, unusual vaginal discharge with a foul odor, painful intercourse, painful urination, and irregular menses, or irregular periods. A male, the smuggler, who is interpreting for her, accompanies her into the examination room. He speaks for her and states that he is her boyfriend and is currently holding their child. There's no one in the clinic who speaks Mixteco. This case study highlights how interactions with potential victims can become examples of heroic help or another missed opportunity. Unfortunately, victims present in varied ways to various healthcare settings, and identifying them is complicated, frustratingly long, and rarely straightforward and simple. Donna says that we can all advocate for more education and training to nursing and medical staff toward establishing policies and procedures for addressing these types of cases. She says that staying informed on the topic and learning about national efforts on the issue can help. There are toolkits online that can be found with a simple Google search that can help further the discussion and provide steps for developing protocols at your facility. Donna says it's important to have the courage to ask questions if your patient has one or more indicators of trafficking. Maybe consider having palm-sized cards at your facility with instructions for calling the National Human Trafficking Resource Center and law enforcement. In addition, she says public awareness campaigns such as hanging posters with this information is a great idea. Donna says there isn't one specific indicator which demonstratively identifies a traffic victim. However, further investigation and questions might be appropriate if a patient presents with one or more of the following indicators. The person doesn't speak English and someone speaks for them. The person speaks some English and someone speaks for them. The person has no money. There are signs of physical abuse or neglect, burns, scarring, unusual tattoos such as a tattoo of ownership. The person appears frightened, depressed, or in distress. It doesn't seem to know where they are. They don't have any identification or travel documents, or perhaps someone is holding the documents for them. There are signs of malnutrition, dehydration, addiction, or they're in general poor health or hygiene. The patient's story seems inconsistent, or it doesn't make sense. Or those who bring the patient in for treatment resist the nurse for speaking with the patient alone. If you suspect someone might be a victim of trafficking, you might consider some follow-up questions to determine the validity of your suspicions. You should attempt to interview the patient alone, and all attempts should be made to bring in an interpreter independent of the patient or any guests, such as a digital teleconference interpreter. Donna says a frequent tactic she used as a crisis interventionist was that she told patients and their guests it's hospital policy to require her to question everyone individually and privately. As discussed, follow-up questions can help you nail down whether your suspicions are warranted. Remember that it's important to have patience, as potential victims are likely traumatized. They might be reluctant to talk. It's important to let the patient know that your only goal is to help them if they want it. Some of these follow-up questions might include, where are you from? What brings you to the United States? How did you get here? What type of work do you do? Do you have a set schedule? Are you paid for this work? How much do you earn? Have you ever been threatened with violence or harm if you decide you want to leave your job? Do you have identification? If not, why not? Does someone else have your documents? Do you have to ask permission to eat, sleep, or go to the bathroom? Do you have to ask permission to talk with others? Are you being forced to do what you're doing? Are you allowed to go out on your own? With where and whom do you live? Are there locks on the doors and windows so that you can't get out? It should be noted that in most cases, a victim has the right to refuse help or assistance offered. Sometimes victims are not ready to seek help due to various reasons. However, there are certain instances where a person would be legally obligated to report certain situations. These persons are called mandatory reporters, and each state defines this group of people differently. Generally speaking, though, this includes teachers, social workers, police officers, medical providers, and clergy. Some events that should be reported include physical abuse, sexual abuse, neglect, and exploitation. In Colorado, this mandatory reportable group includes children 17 years of age or younger, an elder that is 17 years or older. Additionally, this includes an adult with an intellectual or developmental disability. Dorothea Orem developed the nursing theory of self-care. It details how humans develop to become capable of self-care holistically. It is composed of 3 parts, which include the theory of self-care, self-care deficit, and the theory of nursing system. Orem defines self-care as the maintenance of sufficient intake of air, food, and water, the provision of care associated with the elimination process, balances between activity and rest, as well as solitude and socialization, the prevention of hazards of well-being, and the promotion of human functioning. The self-care deficit theory specifies when nursing is needed in the care of patient, specifically when a person is no longer capable or limited in their own self-care. Her theory describes how the nurse can help the patient through 5 methods: acting for and doing for others, guiding others, supporting another, providing an environment promoting personal development, and teaching another. One logical premise a person might take would be, why don't they simply run away? However, this question shows a lack of understanding from the victim's perspective. The answer herein is similar to why domestic violence victims aren't keen to seek help. Sometimes the victims may feel they are being victimized because this type of behavior was normal for them throughout their childhood. The trafficker could be viewed as a romantic partner in cases of sexual exploitation, or in labor trafficking, the trafficker could be looked at as a source of welfare stability. Many times, the trafficker has essentially brainwashed and manipulated the victim into believing that the trafficker has their best interests at heart, while authority figures such as law enforcement, nurses, and doctors cannot be trusted. Often, a victim might not leave out of pure fear the trafficker might harm them or their families. A victim might feel that there is no family, community, or national support. Finally, there are some cultural issues related to taboo topics such as sexual or labor exploitation, which could hinder the victim's willingness to talk about their circumstances. In examining the nursing diagnosis, are you able to hypothesize some potential nursing diagnosis related to human trafficking? Take a moment to reflect on the potential issues you could see arising from the circumstance of being trafficked. Some diagnoses include risk for complicated immigration transition, ineffective protection, risk-prone health behavior, disturbed sleep pattern, labile emotional control, hopelessness, powerlessness, anxiety, risk for compromised human dignity, post-traumatic stress syndrome, risk for suicide, social isolation. Following standards for nursing care plan development, you identify the problem as stated from a nursing diagnosis perspective. The assessment led you to this consideration: the expected client outcomes, nursing interventions to assist the patient to arriving at the outcome, the rationale, and the evaluation. An example care plan on powerlessness might look something like this, where Powerlessness is related to being a victim of psychological abuse, related to being a victim of sexual or labor trafficking, as evidenced by verbal expression of having no control. You want to assess the patient's understanding of current laws regarding trafficking and abuse, the patient's knowledge of resources and organizations willing to help. You want to provide the client with choices and responsibility that will increase their feelings of control. The client's condition prevents their ability to solve problems, thus support is required to realize the benefits of available alternatives and to deal with unresolved issues and accept what cannot be changed. All right, post-quiz time, you made it. In Colorado, which demographics is not eligible for mandatory reporting? Thus, you must respect their right to refuse reporting. I'll give you just a moment. If you chose answer A, you would be correct. Given that this woman is between the ages of 18 and 69, she does not have to be reported if she chooses not to be. We must respect her right for privacy. Identify one nursing diagnosis which could be applied to victims of sexual or labor trafficking. I'll give you just a moment. As you can see, there's plenty of nursing diagnosis to address the issues that these clients would face. However, this is not an exhaustive list. I ask you to refer to the NANDA approved list for nursing diagnosis to come up with your own ideas and considerations. Next, provide any 2 red flag indicators which might prompt further investigation by the nurse. If you selected any of these 2, you might have gotten the answer correct. Although again, this isn't conclusive. Identifying these victims is difficult, and clear signs are not always obvious. In conclusion of this presentation, I ask that you evaluate myself on the following items with how strongly you agree or disagree. And finally, references. Thank you for tuning in.